Thanks, guys. Ohio is dealing with the massive measles outbreak as cases across the country have also skyrocketed. We've been hearing about this a lot nationally and locally. It's the highest number of cases in the past 15 years. So Kelly King joining us now to break it all down for us. What do we know as of today, Kelly?
Katie, actually, it's a really big concern, and I've been researching and making calls all day. And according to the CDC, there were 644 measles cases reported in 2014 in more than half of U.S. states, including right here in Ohio. Now, that's the largest number of cases since the CDC started collecting measles data in 2000. The CDC says the majority of people who contracted measles were actually unvaccinated. Commonly, travelers bring the disease to the States. The outbreak being traced back to unvaccinated travelers to the Philippines. According to the Ohio Department of Health's website, it's now investigating a large amount of measles cases here in Ohio. The total number of cases in the Buckeye State, 382 with 9 hospitalizations. So that means most have recovered on their own. The cases range from those as young as 6 months all the way to 53 years. Knox County is reporting the most cases with nearly 200 people infected. I checked, and right now counties in the Miami Valley aren't reporting any cases here. To prevent the spread, the Ohio Department of Health and local health departments are encouraging people to get the measles, mumps, and rubella vaccine. In almost all cases, people who receive the MMR vaccine are protected.
You know, it's troubling because a lot of people thought we had this knocked out. You know, you don't really hear about this over the past decade so much as we are now. So what can people do to really protect themselves? How does it start, and how do they keep it from becoming an issue for them?
Katie, measles starts like any other disease. So fever, runny nose, cough, loss of appetite, sometimes watery eyes, and then a rash breaks out, and that rash lasts a little less than a week. Now, there's no specific treatment for measles, but people with the disease just need lots of rest and fluids. But good news here is you can't get the measles more than once.
All right, Kelly King, thanks so much for looking into that, and you'll have more for us coming up later on WDTN. John?